This video will look at lifestyle and environmental factors in recurrent pregnancy loss. So I think when we look at lifestyle and environmental factors, I think let's tick off some of the easier ones. Smoking has evidence to show that this is linked to recurrent pregnancy loss in anybody who is trying to conceive. Smoking should cease, and that includes vaping. Alcohol is interestingly, while it's linked to fetal abnormalities and adverse outcomes in pregnancy, there is not as much evidence to link alcohol to recurrent miscarriage or pregnancy loss per se as an exact condition, than rather generally bad outcomes in pregnancy. So for that reason, we do encourage people to abstain from alcohol. Recreational substance use. Obviously, we can't run a randomized control trial to work out whether use of recreational drugs is linked to miscarriage. We do have some population studies that link certain recreational substance uses like THC and other drugs to recurrent pregnancy loss. Drugs like amphetamines and cocaine do change blood flows around the pelvic organs, around the ovaries. So we generally do sort of say illicit drug use should not be recommended in anybody who's planning a pregnancy. Caffeine. I get asked a lot about caffeine. There are some older studies that suggest that caffeine is linked to pregnancy loss, especially recurrent pregnancy loss. However, that linkage seems to be very dose dependent. So 1 to 2 standard cups of coffee don't really seem to have that much of an impact. But once you get beyond sort of 2 to 3 standard caffeinated drinks, and we're talking about 1 standard coffee rather than the highly sort of concentrated caffeine soft drinks that we get, then the risk is significantly higher. Heavy metals. Sometimes I get asked about heavy metals, especially in some of our food, and increasingly people are aware of the presence of these things. There are known adverse effects of pregnancy in general, but in the context of recurrent pregnancy loss, the studies are very contradictory, and we really can't say anything whether heavy metals are a definite cause for recurrent pregnancy loss. I suppose when we talk about nutrition in general, then we do recommend that a well-balanced diet is necessary. I get asked a lot about stress, and both physical and psychological stress, and people undergoing emotional turmoil. Obviously, recurrent pregnancy loss and miscarriage is very stressful. It takes a huge emotional toll. And there is an increased rate of miscarriage, especially recurrent pregnancy loss, in people who undergo more emotional and psychological stress than those who don't. We're a little bit unsure whether what's causing what. Is it people who are having miscarriage, therefore having more emotional stress, or emotional stress causing the miscarriage? There are some really interesting studies that show that if we use essentially a TLC model, so that is lots of touch points with patients and clinicians once they get pregnant, for those who've had recurrent pregnancy losses. So basically, anybody who gets pregnant, they have a call with their doctor every 1 to 2 weeks just to reassure everything is okay, multiple scans, all of that stuff. Those people do better in those studies than people who don't have that constant touch point in terms of live birth. So that's actually quite interesting, I think. The final thing, obesity and low BMI, so extremes of BMI. Both of these have some links to recurrent pregnancy loss. And again, there is that emphasis on healthy BMI. And the mechanisms of that are hugely varied, and that will really be another video or a series of videos, really. The final thing I just want to touch on in terms of environmental and lifestyle issues for pregnancy loss are the endocrine disruptors, and what the media now calls the forever chemicals. Endocrine disruptors are essentially chemicals that have a similar structure and shape to hormones, and they basically sit on hormone receptors in our organs and have essentially downstream changes. When we talk about these endocrine disruptors, we're mainly talking about the plastics, or the plasticizers, so phthalates and BPAs, or bisphenol A's. Phthalates, endocrine disruptors, plasticizers are really hard to study, and the reason is because they're very transient chemicals, and they break down into other chemicals that, while not classified as the original chemicals, they still have negative effects. So for example, BPA will break down to a whole range of things, and those breakdown chemicals are not classified as BPAs. So, but they still have negative effects. And we do see some of these negative effects having like binding to androgen receptors, causing an excess of an androgen or male hormone response, causing essentially excess estrogen response. All of these things do happen. There are some population studies linking endocrine disruptors to miscarriage. And again, as I said, it's really hard to study these properly because they just so easily break down to different chemicals, and we can't really ethically expose a certain population to endocrine disruptors on purpose. So all we have is population data, and that population data says that yes, there is some evidence linking endocrine disruptors and forever plasticizers and chemicals to miscarriage. And really the advice that I give for all patients who are trying to fall pregnant, is whether they're in a recurrent pregnancy loss situation or not, but especially in a recurrent pregnancy loss situation, is to avoid as many of these plasticizers as possible, understanding that it's really hard to avoid all of them in our modern day. I mean, chairs that we sit on would have plasticizers, but for example, buying glass bottles, avoid painting the house, all of these things that are unnecessary, and avoid handling. I mean, the supermarket receipts that you get are full of these chemicals, so avoid handling those receipts, have it emailed to you. So simple things to actually see if we can make a difference to improving the live birth outcomes.